Okay, cardiac failure by Sayyida Darendal Heba. Cardiac failure. The reduced ability of the heart to pump blood is called cardiac failure. Causes. What are the causes of the cardiac failure? The decreased contraction of myocardium, increase in the external pressure on the heart, and vitamin deficiency, especially vitamin B deficiency, and damaged valves of the heart. Acute effects of moderate cardiac failure: increase in the venous pressure and decrease in the cardiac output. Now look at the graph right over here. At point A, it's very clear that this graph is between the cardiac output and between the right atrial pressure. Now when at this point A, you can see 5 liter per minute cardiac output. That is normal cardiac output. It doesn't suggest cardiac failure. Cardiac failure is the reduced ability of the heart to pump blood. So it's reduced cardiac output. But here, the normal cardiac output, that is 5 liter per minute. And at this cardiac output, you can observe that there is normal pressure, that is 0 mm of Hg. Means it's the right atrial pressure is normal in the rest condition. Now what happens? Okay, first of all, get it clear from the table also. Point A, we were discussing point A, 5 liter per minute cardiac output. That's a normal cardiac output. There is no still cardiac failure, and it's right atrial pressure, that is 0. Point B, you can see a decreased slope, that is at point B. From A to B, there is a decrease in the slope, and it shows a plateau that can suggest that at point B there is increase in the right atrial pressure. It's clear that it's plus 4 mm of Hg, and at point B you can also clear yourselves that the cardiac output is less than 5, that is almost half. It's 2 liter per minute. It's less than 5, it's almost half. Now this point B, on the table you can come and you can see that the point B suggests that there is a decrease in the cardiac output. Now look at from the points: decrease in the cardiac output and increase in the right atrial pressure. So here is increase in the right venous pressure, that definitely increases the right atrial pressure. Right atrial pressure is increased because there is the increase in the venous blood returning to the heart from the body. So the blood is damped up in the right atrium and there is increase in the right atrial pressure. I'm again repeating my words, that you can see at point B there is the you can see at point B there is the decrease in the slope. What does this decrease suggest? Decrease in the cardiac output, it fills the property. Okay, and increase in the right atrial pressure, that is plus 4 of mmg. You can see from 0 to 4 there is the increase in the right atrial pressure but decrease in the cardiac output. So the point B suggests the more acute cardiac failure. Now you can see that there is increase in venous pressure and there is increase in right atrial pressure. Now the increase in venous pressure suggests that there is the increase in venous blood returning to heart. Increase in venous blood returning to heart. So the blood starts to dam up in the right atrium. Now, when the blood starts to dam up in the right atrium, it is clear that right atrial pressure increases. And it's clear from point B. These 2 points suggest that a person is suffering from acute cardiac failure. Now, we're going to move to point C. Okay. When you see from A to B, the slope is decreasing. But now what happens that from B to C, we're moving up. What does this up suggest? Still there is increase in the right atrial pressure. There is increase in the right atrial, it's almost, you can see 5 mm of Hg. But look at the cardiac input. Okay, it's increasing. It's 4.2 liter per minute. And 5 mm of Hg is the right atrial pressure. So it's near to 5. So you can suppose that it's 4.2. I'm again discussing point C. You can see the point C over here, that is the increase in the slope from B to C. Now, point C. What does the point C chest? Look at the curve. It's somehow in this color, and it shows that this is the damaged heart, but something in addition is sympathetic stimulation. So what is the reason that the graph is moving upwards from B point to C? Okay, the graph is moving from B to C, and what is the main reason? It's sympathetic stimulation. Okay, now you can see at point C the right atrial pressure increases. It's almost 5 mm of Hg, and the cardiac output is also increasing. It's less than 5. It's less than 5, but still near to 5. So we can say it's somewhere 4.2 liter per minute. This is the cardiac output that is reaching almost to 5. But when we were discussing point B, we were clear that it's too much decreased cardiac output from 5 to 2 liter per minute. But again, at point C, we have observed the increase in the cardiac output, but there is an increase in the right atrial pressure also. It's very important for you all to know that there is the role of sympathetic stimulation. What happens in sympathetic stimulation? Your baroreceptor reflexes, your chemoreceptor reflexes, even the CNS ischemic responses, they become activated, and they stimulate your sympathetic stimulation. When your sympathetic stimulation is activated, it is stimulated, what happens? That your heart becomes to pump more blood. It becomes stronger. You can see that there is still increase in the right atrial pressure because sympathetic stimulation also increases the venous return. Remember my point that whenever the venous return is increasing, there is increase in the mean systematic filling pressure, and this filling pressure further increases the tendency of the blood to flow from the veins back to the heart. That is increase in the venous return, that is increase in the right atrial pressure, because the blood moving from veins to heart goes to your right atrium, and in the right atrium there is increase in the pressure. Okay, I'm again repeating that the sympathetic stimulation increases the venous return, due to which the right atrial pressure increases. Okay, but it also increases the cardiac output. Now, when the sympathetic stimulation is activated, the heart becomes a stronger pump. As a result of sympathetic stimulation, almost two-folds. You can see from 2 to 4. It's the double of 2. So it's two-fold increase in the cardiac output because of the activation of sympathetic stimulation. So what we can conclude is that the partially damaged heart can be recovered. It's like partially recovered heart at point D, but before point D you can see point C. A damaged heart with the sympathetic stimulation leads to the partial recovery of the heart. You can see right over here, it's partial recovery of the heart. But how did you reach the slope? First you suffered from acutely damaged heart, then the damaged heart causes sympathetic stimulation to be activated. It's all done by the heart itself. When the heart sees that the right atrial pressure is increasing but cardiac output is decreasing, then within few seconds it sends its reflexes to activate the sympathetic stimulation. That results in the partial recovery of the heart. So I think it's all clear. Okay, now we're going to discuss point D. The point D is of quite importance. Like you can see the cardiac output is reaching almost near to point A, but it's not exactly 5. It's somewhere 4.8, or you can say it's 4.9 liter per minute. It's not exact 5, but it is near to 5. 5 liter per minute is actually the normal cardiac output that is used to show that the person is in rest. With a normal cardiac output, the heart is not suffering from cardiac failure. Now, we're going to discuss point D. You can see there is increase in the right atrial pressure. It's almost 6 mm of Hg. So I'm not saying the heart is recovered completely. It's the partial recovery of the heart. So you have to focus that the heart is recovered partially by the sympathetic stimulation. It's not recovered completely. So the cardiac output is almost 4.8 or 4.9. It's near to 5 but not 5. And why the heart is not completely recovered? If you want your heart to be completely recovered, you should keep in your mind that the right atrial pressure should not increase, but it is increasing continuously. So because sympathetic stimulation increases the right atrial pressure, so right atrial pressure increases simultaneously, but the cardiac output is also reaching to its normal point. So it's a partial recovery of the heart. Okay, chronic stage failure. Retention of the fluid by the kidneys is called chronic stage failure. And one more important thing, maybe if you're gonna look at the slide and you can say, okay, it's I right over here. So please ignore I. Spelling mistakes should be ignored by the medical students. So it's a rule. Okay. Chronic stage failure leads to retention of the kidney and varying degree of the recovery of the heart itself. Now what happens that maybe the heart recovery itself, it activates its sympathetic stimulation, or by some other source it starts to recover, and this recovery depends upon how much extent this recovery is done, and this recovery is actually showing the chronic stage failure, whether your heart has become fail and it is recovered. And the other point is retention of the fluid by the kidneys. So the retention of the fluid by the kidneys can be moderate and can be excess. And a very important thing to tell you is that the fluid retention can be moderate and it can be excess. So everything that is in excess is harmful. You always know that the thing that is in excess is harmful. So you should remember this point. Similar point happens in the kidney. The excess fluid retention is harmful. Okay. Moderate fluid retention. Let me tell you first, we are gonna discuss fluid retention, and first I'll tell you about moderate fluid retention that is beneficial. First of all, we have to discuss the benefits of something, and then whenever we're gonna take medicine, we take medicine and then we ask whether it has some harmful effects or not. So side effects are considered after the benefits. So excess fluid is harmful. First topic of discussion will be moderate fluid. Moderate fluid retention. What happens in the moderate fluid retention? A little amount of fluid is retained in the kidneys because there is increase in the right atrial pressure. And when there is increase in the right atrial pressure, the blood starts to increase its volume. There is increase in the venous return, that the blood moves from the veins back to the right atrium, back to the heart. You can see the blood goes from right atrium into the lungs. The veins are giving back blood to the right atrium. Right atrium moves the blood into right ventricle and then into the lungs, again into the left side of the heart. But all this is increasing the blood volume, increase in the venous return. Now mean systematic venous pressure increases. Sorry, it's not systolic venous pressure, it's systematic venous pressure. And I think the humans are the ones who do mistakes, and mistakes are forgiven as a good human. So we are not angels, so you should accept some mistakes from our sides too. Okay, it's systematic venous pressure, increase in mean systematic venous pressure. As I told you before, when there is fluid retention, there is increase in the venous return. There is increase in the mean systemic venous pressure. And what happens? When you can see that all these things are increasing, there is distension of the veins. What happens with the fluid? That when the two things the fluid is doing. Okay, first is it is increasing the mean systematic filling pressure. When this pressure is gonna increase, your right atrial pressure is gonna increase, your venous return is gonna increase. Got my point? You can move from downwards to upwards again. And the other main point is it causes the distension of the veins. The moderate fluid retention is so important that it causes the distension of the veins. You take a shopping bag, you place the water in it, you observe that it causes some kind of distension. So similar distension happens in the veins. I think it's not more appropriate example, but you may be cleared. Now, when there's distension of the veins, there is what happens is the reduced venous pressure. There is a reduction of the venous pressure. Now, I'll tell you what is compensated heart failure. Your heart is damaged, but if your heart failure is at the level that the partial recovery can be happen, then you can count that if the partial recovery of the heart can happen, so your heart is said to be compensated heart failure. How why I'm saying that the heart failure and compensated, two words kind of failure and compensation are opposite. But actually when you are suffering from heart failure, when there is a heart failure in the patient, it can be compensated if you're lucky. So partial cardiac recovery of the heart, but with the fluid retention, the words to be focused, and increased right atrial pressure. As I told you before, there is not complete recovery of the heart. It's partial recovery. So what the partial recovery suggests, that there is fluid retention as the fluid is returning. Okay, I told you before that there is fluid retention in the moderate cardiac failure. There is retention in the moderate in the acute cardiac failure, the moderate fluid retains. So you can see right on the slide that whenever you are suffering from a cardiac failure, there is the retention of the fluid. If it is moderate, it's beneficial. Partial recovery of the heart. Okay, if it's beneficial